Hi there, Andrew with Zang Physical Therapy, and today I'm back with part 2 of my Dizziness and Neck Pain series. If you're someone who has dizziness and maybe also has neck pain, or you know somebody who has these symptoms, this video is for you. And so the other day when I was on, I shared a little bit more, technically speaking, about what it is and how it can be treated. So now I want to share a story about a lady who I saw, it was probably 3 or 4 months ago now, that was, she was the inspiration, more or less, to write the article and to talk about this topic. And so this individual, she's in her mid-40s, and she's been dealing with both neck pain and dizziness for probably, good 6 to 8 months. And she'd seen her primary care doctor, she's seen an orthopedic, she was sent to a rheumatologist to look at things, she saw an ENT doctor, she saw a neurologist, she was given all kinds of different medications that they played with to see if it would help anything, but yet nothing did. She was becoming very discouraged and frustrated that every day, as she was trying to be active, dealing with her kids, she'd get dizzy and have to lay down sometimes. She was becoming more and more scared and nervous driving because turning her head quickly to check her blind spot and whatnot, and just all the stimulus from driving was starting to get to her. So she was just about reaching the point where she wasn't going to drive anymore until this was under control. But she needed to drive because she had 3 kids, and they had sporting practices and whatnot to deal with. So she ended up hearing about me through another friend, and she was kind of skeptical when she came and sat down. We did a consult, and she outlined her whole story for me, and we did a little bit of an examination, and I thought we had something that was going to be helpful for her. So I outlined what we might be able to do, and told her what it might look like and how things might get worse as we are treating her before we got to the good stuff for her. So she thought about it for over the weekend, because I think our initial consult was a Thursday. She thought about it over the weekend, called me up Monday, and was like, I'm ready to do this. I'm tired. I can't continue to live being dizzy every single day of my life. So she called me on Monday. I saw her on Tuesday, I believe. And that first session was a little bit of a struggle. We did provoke her dizziness to a degree. By the time she walked out, she was about her baseline. So whatever we provoked during the session did calm, which was what I wanted before I let her leave my office and drive back home, because she didn't have a driver with her. And she had a set of 2 exercises that she was to do to complement what the treatment was. And I saw her then again that Friday, and she came in and said, my symptoms are maybe 15 or 20% better. I'm like, that's great. We made a 20% change. And she outlined a little bit of what she felt specifically was better, because that's important. What she feels changed in a positive way. So we dove into treatment again, did a little bit of the same in terms of some soft tissue work in the neck, some hands-on stretches for the neck, some guided movements, and just teaching her to do some things. And then we got into some other interesting stuff by visit 3 and visit 4, where we were doing some training for her balance system as well, and her visual system. And we put all 3 pieces together. And she didn't quite initially understand why we were doing some of these eye tracking exercises, but she had faith that something was going to happen and that somebody was going to help her achieve what she wanted. So she started doing the eye training exercises with some of the neck muscle exercises, and little by little over the course of the next 2 to 3 sessions. So I think we're up to probably about session 7 or 8 now. She comes in and she said, I had my first day without dizziness. And she was so happy and so excited and so positive with what was happening that she's like, everything you gave me to do at home, I'm doing it on a routine schedule, and I'm really starting to feel good, and I know this is going to work. I know we just need to keep this up. And you know what? She was right. We had, broken everything down. We'd addressed all the pieces of the puzzle, which unfortunately weren't addressed with the regular medicine system. Medication wasn't going to fix her problem. She needed to work basically from the inside out, working with her muscles, working with her joints, and restoring balance in her balance system and her visual system. Because somewhere along the way, the signals got crossed. And so at this point, she had a great program. And so I was like, okay, wonderful. You know your exercises, you're doing diligently. Go do them yourself for the next 2 or 3 weeks. And then give me a call, and we'll see where you're doing, and then we'll make a decision there. So I get a call from her 2 weeks later. She said, I've had 1 day dizziness in the last 2 weeks. And so I asked her, was there anything different that day, that you were dizzy? And she couldn't really come up with anything. So I said, okay, not a big deal. You had 13 out of 14 days you felt pretty good. After 6 to 8 months of feeling crappy, so you're still on it. Do you feel that we need a follow-up session to tune everything up? And she said, let me go 1 more week, and then yes, we will sit down. So she did that next week, and she came back, and that whole other week she was still fine. But she came in, we reviewed her program, made a few tiny tweaks, and sent her on her way. And I said, absolutely give me a call if anything changes. So I get a call 2 weeks later, and she says, everything's great. I've had another 2 weeks without dizziness. I know what to do. So at that point, she was like, I got it. Okay? And it can be this way if you're somebody out there who has similar symptoms. There's no need to continue to deal with it on a weekly basis. If you're tired of not getting a solution from the medical system, how about you try something else? So if you have any questions related to this, please feel free to leave a comment below or send me a message. I will gladly get back to you, talk about your problems and what the potential solutions are, so you can get back to living life without being dizzy, and maybe having neck pain if you have that as well. Have a nice day.